Hi, I'm Time for Kids kid reporter Lucy Sandor. I'm 11 years old and I live in Caldwell, New Jersey. I'm here today with Dr. Vivek Murthy, the United States Surgeon General. My first question is pretty simple. What is a Surgeon General?
Well, Lucy, that's a great question. Well, the Surgeon General has two jobs. Number one, making sure that people all over the country have access to good, accurate information based on science so they can make good decisions for themselves and their families about their health. And the second role of the Surgeon General is to oversee one of the 8 uniformed services in the US government. So you're familiar probably with the Army and the Navy and the Air Force. Well, one of the other uniformed services we have is the Public Health Service Commission Corps. And these officers, are about 6,000 of them. They include doctors and nurses and pharmacists, but they go all over the country and sometimes around the world, helping people when there's a health crisis.
I'm 11 and I'm really looking forward to getting my COVID vaccine since it was just approved by the CDC. Some of my friends are worried and a little afraid though. Is there any advice you have for them?
Well, this is what I would say to your friends, Lucy, and what I hope that all young people and all parents understand about the vaccine for kids. Number one, these vaccines were approached really, really carefully. They were studied in clinical trials, which are scientific studies that involve thousands of young people in the 5 to 11 age range. And they found two important things during this study. One was that the vaccines were actually really effective in preventing young people from getting COVID. In fact, they were more than 90% effective, which as far as vaccines go is really, really high. The second thing they found is that the safety profile of these vaccines was really, really good. When people did experience a side effect, it tended to be something like soreness in the arm where they got the shot, or some redness or swelling in the arm, or some fatigue, for a day or two. But all those symptoms went away pretty quickly. And what they were left with was protection against the virus. We have 190 million people in our country who are now protected against COVID because they've been fully vaccinated. That's a big deal. And now that we have a vaccine for kids under 12, that means that 28 million people more in our country will have a chance to get vaccinated and protected as well.
I know you have done a lot of research on loneliness and how it negatively impacts adults' health. Do you think it affects kids the same way?
Well, Lucy, I'm glad you asked because I think it's really important that we talk about loneliness, because if you are feeling lonely, if you're feeling isolated, it doesn't mean that something's wrong with you. It doesn't mean that you're a loser somehow or that you're flawed in some way. It's a very normal part of the human experience. And a lot of people feel lonely. Now, it doesn't always look like that from the outside. So you can't always judge based on how many parties somebody's going to or how many friends they seem to have about whether they're lonely or not. So what's important is that we recognize that each of us has a really powerful role that we can play in each other's lives simply by being a friend, by showing up and being present, by caring about somebody else, by listening to them when they're having a hard time. And if COVID has taught us anything, it's that we really do need each other and we do better when we take care of one another. So let's just remember that this is a time where being kind, being compassionate to each other is more important than ever before. It's what's going to make this pandemic much easier for us all to get through.